Picture this: you're in the middle of a busy day, maybe finishing up some work, grabbing groceries, or chatting with a friend. Everything feels normal, but then there's a subtle shift. Maybe it's a headache that comes out of nowhere, or a strange feeling of fatigue. These small, often unnoticed changes could be your body's early alarm bells for a stroke. You might be thinking, "I feel fine." But here's the thing: strokes often don't just appear without warning. Your body may be telling you something weeks in advance. The real question is, are you listening? Today, we're going to talk about 7 signs that could show up as early as a month before a stroke hits. By the end of this video, you'll know how to spot them and, just maybe, prevent a life-changing event. Let's get started. 1. Persistently high blood pressure. High blood pressure, it's called the silent killer for a reason. But here's a question: when was the last time you really thought about your blood pressure numbers? Maybe your doctor mentioned it was a bit high, but nothing to worry about, right? Wrong. Persistently elevated blood pressure is one of the most common and dangerous risk factors for a stroke. And the scary part? Many people have no idea they're at risk. Over time, high blood pressure damages the delicate lining of your arteries, weakening them and making them more susceptible to rupture. If this happens in your brain, it can lead to a hemorrhagic stroke, where blood leaks into brain tissue, causing severe and often permanent damage. Now, you might be thinking, "But I'm young, healthy, I exercise." Well, here's the wake-up call: strokes aren't just an older person's issue anymore. They're happening more frequently in younger people, even those in their 30s and 40s. If you've noticed your blood pressure numbers creeping up, even if you feel fine otherwise, this could be your body's first red flag. Ignoring it might cost you more than just peace of mind. 2. Unexplained extreme fatigue. We all feel tired sometimes, right? But what if you've had a full night's sleep, you're not pushing yourself too hard, and yet you wake up feeling like you've been hit by a truck? This kind of fatigue is more than just being tired, it's your body's way of signaling that something's off. When we talk about stroke symptoms, most people don't think of fatigue. But, in reality, unexplained extreme tiredness can be one of the earliest indicators. Let's dig into why that happens. When blood flow to your brain is even slightly restricted, it struggles to get the oxygen it needs to function at full capacity. This can leave you feeling drained, even if you've done nothing to exhaust yourself. It's not just being busy or burnt out, it could be your brain signaling that a blockage is forming, cutting off the essential oxygen it needs to keep you going. So, if you find yourself battling constant fatigue without a clear reason, don't just brush it off. It might be more than just stress. It could be your body's early warning system trying to get your attention. 3. Sudden vision changes. Let's shift to a symptom that's easy to overlook: sudden vision changes. Imagine this: you wake up one morning and your vision is blurry, or maybe you start seeing double while reading something you could normally read just fine. These are more than just signs of aging or staring at a screen for too long. Sudden changes in your vision could be an early warning sign of a stroke. Why? Because your eyes are directly connected to your brain. The optic nerve, which controls how we see, relies on a constant supply of oxygen-rich blood. If a stroke is on the horizon, especially an ischemic stroke that involves a blockage in the arteries, your vision can be one of the first things affected. You might experience blurry vision, difficulty focusing, or even partial blindness in one eye. Often, people dismiss these changes, assuming they'll pass, or that it's just a temporary issue. But here's the thing: vision problems that appear out of nowhere aren't something to ignore. If you or someone you know experiences a sudden, unexplained change in vision, it could be your body's way of throwing up a red flag. Get it checked out immediately, because this could be a crucial warning before a stroke. 4. Severe, sudden headaches. Headaches are common, right? But have you ever experienced one that feels like the worst headache of your life? I'm not talking about a typical tension headache or a migraine, but a sudden, sharp pain that seems to come out of nowhere. This kind of headache can be a sign of a hemorrhagic stroke, and it's not something you want to take lightly. When we talk about strokes, we often focus on blockages, but in a hemorrhagic stroke, the problem is bleeding. A blood vessel in your brain bursts, leading to a rapid increase in pressure within your skull. This pressure causes a headache so intense it's often described as unlike anything you've ever felt before. And it's not just the headache. People who experience these types of strokes often report other symptoms alongside it, like nausea, vomiting, or dizziness. If you're hit with a headache that's so severe it feels like an emergency, and especially if it's accompanied by those other symptoms, don't wait. Get to a hospital. A headache like this could be your body's final warning before something catastrophic happens. 5. Numbness or weakness. Here's a question: have you ever woken up with a numb arm or leg and thought, oh, it's just asleep? Maybe that's true most of the time. But what if that numbness comes on suddenly or happens out of the blue? What if it's only on one side of your body? This could be a classic sign of a stroke. Strokes affect the brain, but because your brain controls your muscles, a stroke can cause sudden numbness or weakness in one side of your body. Maybe it's your arm, your leg, or even one side of your face that suddenly feels numb or weak. It's a sign that blood flow to a specific part of your brain is being interrupted, and the muscles in that area are losing their ability to function properly. Even if this sensation goes away after a few minutes, don't ignore it. You might be dealing with a transient ischemic attack, TIA, also known as a mini-stroke. While a TIA might not leave lasting damage, it's a huge warning sign that a full-blown stroke could be just around the corner. 6. Speech difficulties. Imagine this scenario: you're in the middle of a conversation, and suddenly, the words you're trying to say don't come out the way you intend. Maybe they're slurred, or perhaps you know what you want to say, but you just can't seem to get the words out. This is called aphasia, and it's a major warning sign of a stroke. When a stroke cuts off blood flow to the parts of the brain responsible for language and communication, your ability to speak can be affected, often suddenly and without warning. Struggling to form words, speaking in jumbled sentences, or even losing the ability to understand what others are saying can all be signs that something is seriously wrong. If this happens to you or someone nearby, it's not something to wait out. Time is critical when it comes to strokes, and speech difficulties could be one of the last warnings before a major stroke hits. Call for medical help immediately. 7. Neurological problems. Balance, memory, and nausea. Lastly, let's talk about neurological issues, symptoms that people often don't connect with strokes, like memory problems, sudden loss of balance, or unexplained nausea. These can be some of the most subtle signs, but they're just as important. When your brain isn't getting enough oxygen due to reduced blood flow, all kinds of things can start to go wrong. You might feel off balance, like the ground is shifting under you. Maybe you find yourself struggling to remember simple things or feeling confused about routine tasks. And nausea or vomiting without any other obvious cause can also be a sign that your brain is in distress. These neurological issues can appear in the days or even weeks leading up to a stroke. Unfortunately, because they can be subtle, they're often misdiagnosed or dismissed entirely. But make no mistake, when these symptoms appear out of nowhere, they could be your body's final warning before a stroke occurs. So, what's the bottom line? Strokes don't just come out of nowhere. Your body will give you signs, whether it's through sudden vision changes, unexplained extreme fatigue, or a severe headache that feels like nothing you've ever experienced before. The key is to pay attention. If you or someone you love experiences any of these symptoms, don't wait. Seek medical help immediately. Early detection and swift action could mean the difference between life and death, or between a full recovery and permanent disability. Thanks for watching, and don't forget to like, subscribe, and share for more natural health tips. Until next time, stay safe and stay alert.